Okay, let's unpack this. Imagine you're grappling with chronic pain, seeking relief. But the options for medical cannabis feel, well, a bit inconsistent. Today, we're diving into a fascinating new approach that promises to change the game. Our mission in this deep dive is to explore the long-term effectiveness and safety of medical cannabis delivered through a revolutionary device, the SyqeAir Inhaler. We've got a comprehensive research paper, long-term effectiveness and safety of medical cannabis administered through the metered dose Syqe inhaler, which meticulously analyzes real-life data.
Yeah, and what's fascinating here is how this device aims to address some of the biggest challenges in medical cannabis treatment, particularly the variability in dosage and its effects. We're looking at a solution that tries to bring a new level of control and predictability to a complex area of medicine.
Medical cannabis use is definitely on the rise globally for pain treatment, but it comes with its own set of hurdles, right? Why is it so difficult to get a consistent therapeutic effect?
That raises an important question. One major issue is the lack of readily available, standardized titration regimens and stable, effective doses. Clear guidance on how to start low and slowly increase. Plus, cannabis cultivars vary widely in their phytocannabinoid and terpenoid profiles. Think different strains, different chemical makeups.
Right, so not all cannabis is created equal.
Not at all. Then you have multiple administration routes, like oral, sublingual, or inhalation through smoking or vaporization, each with different bioavailability. How much actually gets into your system? If we connect this to the bigger picture, these variables lead to considerable variability in D9-THC concentrations in the plasma, even with preferred methods like inhalation, which many patients choose for its fast onset. This makes transforming medical cannabis into a truly acceptable medical treatment a constant challenge.
Okay, here's where it gets really interesting then. How does the SyqeAir Inhaler tackle this challenge of inconsistent delivery?
Well, the SyqeAir Inhaler is a novel, metered selective dose medical cannabis inhaler designed specifically to counter that variability. And it's important to note it's an inhaler, not a vaporizer. It produces and releases an aerosol directly from a cannabis inflorescence, the flower.
An inhaler, okay. How does it work?
It works by heating medical-grade cannabis to a temperature below combustion, so no burning, no smoke. Crucially, it uses automatic thermal and airflow controls to ensure uniform, accurate, and high-efficiency delivery of the produced medical cannabis aerosol directly to the patient's lungs. And this delivery is independent of the individual patient's inhalation pattern, which is a significant breakthrough. It doesn't matter how hard or fast you breathe in, within limits.
So it's not just taking a puff, it's a precisely controlled mechanism. Can you walk us through the actual inhalation process? What's that feel like?
Absolutely. The inhalation process is designed to be similar to shallow breathing at about 3 to 15 liters per minute. Pretty gentle. After the user inhales for about 1.8 seconds, the inhaler airway momentarily blocks, creating a gentle resistance. Then the airway opens, initiating a chase air pulse that flushes the aerosolized medical cannabis past anatomical dead space and deep into the lungs, significantly enhancing its bioavailability, getting it where it needs to go efficiently. The entire process is remarkably quick, lasting only 2 to 5 seconds. For example, a single inhalation of 500 micrograms D9-THC takes just 2.8 seconds.
Wow, that's fast. And what about the actual cannabis material it uses? You mentioned variability earlier.
Right, good point. The device utilizes a cartridge containing 60 preloaded vapor chips. Each chip holds 13.5 nullidah, 0.9 milligrams of processed granulated pharmaceutical-grade cannabis flowers from the Bedrocan cultivar.
Bedrocan, so a specific standardized type.
Exactly. This material is meticulously prepared, free of pesticides, heavy metals, stalks, foreign materials, and regularly confirmed for microbiological purity. Quality control is key. The inhaler also uses an RFID label system to authenticate the cartridge, ensuring only the intended material is used, and automatically logs the inhalation process. Data tracking. And it's electronically configured to deliver consistent, metered doses of either 250 or 500 microgram D9-THC, which serves as an indicator for the full spectrum of phytocannabinoids and terpenoids in that specific cultivar.
Okay, so with such an advanced delivery system, what did this long-term, real-world study reveal about its effectiveness? Who are the patients involved?
Well, the study retrospectively analyzed data from 143 patients with a mean age of 62 and 54% were male. A significant majority, 72%, were diagnosed with chronic neuropathic pain, often a tough condition to manage. The treatment regimen was individualized, with a titration plan guided by professional nurses from Syqe's patient support program. For example, naive patients started with 250 microgram D9-THC doses per day, while experienced users started with 500 microgram D9-THC doses, very gradual and supported.
And what were the results regarding pain reduction? Did it work?
Yes, significantly. After an average titration phase of 26 days, patients reached a stable daily dose of about 1,500 micrograms, or 1.5 milligrams of aerosolized D9-THC. The study found significant pain reduction. In the overall population, there was a 22.8% pain reduction, and for patients who started with severe pain, defined as 8 or more on that 0-10 numeric pain scale.
Yeah.
That reduction was even higher at 28.4%. Specifically, average pain intensity decreased by 1.62 points from a baseline of 7.3 down to 5.5 after 120 days of treatment.
That's a considerable drop in pain. Did it affect other aspects of their lives? Quality of life, for instance?
Absolutely. The study also evaluated quality of life, QOL. A remarkable 92% of patients reported an improvement in their QOL.
92%.
Yep. And 59% reported better, and 33% reported much better. Importantly, no patients reported a worsening of their QOL. Furthermore, among patients who are using opioids, 58% reported reducing their opioid doses after 120 days of using the SyqeAir Inhaler, indicating a significant opioid-sparing effect.
Wow, that's huge. Reducing opioid use is a major goal.
Definitely.
Okay, effectiveness is crucial. But what about safety? We know that medical cannabis can have side effects. How did the SyqeAir Inhaler perform in terms of adverse events?
This raises an important question because safety is paramount. The study found a superior adverse event profile compared to conventional medical cannabis administration routes. Now, 41% of patients did report at least one treatment-related adverse event.
Right.
But the vast majority, 64%, occurred during the initial titration phase, that adjustment period.
So the side effects were mostly right at the beginning.
Precisely. After the titration period, the incidence of adverse events declined sharply. From 34% of patients reporting AEs at 1 month, it dropped to 4% at 3 months.
They drop.
And then to 1% and 2% at 6 and 9 months, respectively. Crucially, no adverse events were reported at 12 and 15 months, indicating really good long-term safety and tolerability once the dose was stable.
No AEs reported at a year. That's impressive. What were the common ones initially?
The most common AEs were dizziness, reported by about 18%, headache, around 11%, and sleepiness, about 8%. Most were short-termed, with a median duration of just 15 minutes, and they resolved spontaneously without intervention. What's also compelling is that only 7% of patients reported psychoactive AEs like anxiety and restlessness, which is significantly lower than figures reported for other administration methods. That can be a real barrier for some patients. In fact, the overall rate of AEs reported with the SyqeAir Inhaler was 35% lower than what patients experienced with their previous medical cannabis use via other routes. So 41% with the inhaler versus 76% previously, a marked improvement.
So what does this all mean? When we put it all together, the effectiveness, the safety, the unique delivery.
Yeah.
What's the big takeaway about the SyqeAir Inhaler compared to other medical cannabis administration methods?
Well, if we connect this to the bigger picture, the SyqeAir Inhaler demonstrated comparable pain reduction to other forms of medical cannabis, but crucially with a significantly superior safety profile. That rapid decline of adverse events to almost none during the long-term maintenance phase is a key differentiator.
And the dose. You mentioned it was quite low.
Exactly. What's truly fascinating here is the dosage. Patients using the inhaler achieve these positive outcomes with a mean daily stable dose of only 1.5 milligrams of aerosolized D9-THC. That's tiny compared to typical doses.
That's tiny.
Well, recommended daily doses can range from 40 to 50 milligram orally sublingually, or even 10 to 200 milligrams for traditional medical cannabis in some places like Israel. So 1.5 milligrams is a fraction of that. This much lower dose translates to lower D9-THC plasma levels, which fall within the established therapeutic window for pain relief, helping to avoid the higher plasma levels and associated AE seen with other methods.
So it's about getting the right amount consistently without the excess that often causes problems.
Exactly. The inhaler enables repeatable, metered dosing and structured titration. This allows for achieving a stable and consistent steady-state dosage, drastically reducing the variability in plasma D9-THC levels that often occurs with smoking or vaporizing. This consistency helps to prevent overdosing and minimizes adverse events over the long term, offering a more controlled and predictable therapeutic experience for patients. Uniformity is really the goal.
This deep dive into the SyqeAir Inhaler has shown us a compelling picture. Long-term pain reduction, improved quality of life, and a significant reduction in opioid use, all achieved with a fraction of the typical medical cannabis dose and a remarkable safety profile. It's clear this isn't just another way to administer medical cannabis, it's a carefully engineered solution.
Yeah, what's fascinating here is the potential for such advanced meter-dose delivery systems to reshape how medical cannabis is viewed and integrated into mainstream pain management. This raises an important question. Could this type of controlled, consistent delivery pave the way for broader acceptance and more standardized medical applications? Moving beyond current debates and truly unlocking the therapeutic potential in a safer, more predictable manner.
A very important question indeed.
It certainly warrants further large-scale exploration, but it offers a really promising path forward.